Hello, this is Irene Tobias, and this is part 3 of the video, What to Do When You Get Diagnosed with Cancer. Um, the end of the last section of the video, we were talking about guilt. Um, I myself had a lot of guilt over the fact that my daughter was just 10 years old when I got diagnosed. Um, I had a lot of guilt around the fact that my friends and relatives were scared, were confused. They were feeling the same feelings that I was going through. The only difference is that they also feel helpless. I had many friends that did not live in my area, and so they were just waiting to get information all the time. And the information changes constantly on your case, on your journey. Um, and in my group of friends, I was always considered very strong. And so I had that guilt of, well, I'm supposed to be strong for them because they think they look at me as the strong one, and they're depending on me to stay strong. When I started going to a cancer group, one of the things that was talked about was, you know, you're not responsible for anybody else's feelings other than your own. And you have so much going on as it is that guilt, um, should not be in the picture. It's really hard to say that. It's really hard to tell somebody, yeah, don't feel this way or that way. Um, but was my experience with guilt. And if you're feeling guilty, I totally get it. I totally understand it. But if there's any way that you can reduce the amount of guilt that you're feeling, it'll just help you in the end. Let's see, what do I have next here? So once you start chemo, um, once again, everybody has different reactions. There are people who work the entire way through. Um, they have bad days, they have okay days, but they're still able to work every single day. There are people uh, like me. I just had so many appointments in the beginning that there's just no way I could work. And then when I started chemo, I was receiving chemo once a week. And it took about 4 treatments for it to finally affect me. So when I was first treated with chemo, I still had the opportunity to get everything in order, everything, situated. I had my team ready to go, and just a quick side story. It was really cute. At the time, I lived in an apartment, and there was a family that lived above me on the second floor. And they had a 9-year-old little girl who took it upon herself to take care of me. And every single day after school, she would come to my house. I left the door unlocked because I knew she was coming. And she always, do you need anything? Can I do something for you? She just got so much joy from doing the dishes or anything, and I can't say that I needed the help because I had such a huge team of people helping me, but just to see her joy in being able to help, um, it was really very, very sweet and very, very tender. And, but yeah, she visited me every single day until I was too sick to have any visitors. So, anyway, so one other thing I would like to mention is when when I was first starting my treatment, trying to be very careful in my words here. My original plan was I was supposed to get 2 12-week rounds of chemo. So I was supposed, I was getting chemo once a week. So for the first 12 weeks, they were treating the breast cancer with 3 different drugs, 3 different chemo drugs. And then the next 12 week was supposed to start, and that was going to be another 12 weeks for the ovarian cancer chemo. And for whatever reason, I reacted very, very poorly to the chemo. So by the time I kind of feel like I just barely made it the 12 weeks. And then I made it through the 12 weeks, but in that 12-week period, I had to get 2 or 3 blood transfusions. So I did not take the chemo very well. I was extremely weak. Just basically all I could do was just lie in bed, really. And I was very, very sick. So because I was doing so poorly with the first round of chemo, they gave me, I think it was 2 weeks off before we were supposed to start the next 12 weeks. And so when I started the next 12-week cycle, I literally only made it through 1 week. And I got very, very sick. I was in the hospital with neutropenia, which means you have no white blood cell count and no red blood cell count, or almost none. I had 0 white blood cells and a very small amount of red blood cells. And there's literally no medicine they can give you to help you to boost the production in your own body of white and red blood cells. So I literally just laid in the hospital for 4 days waiting for those numbers to pop back up. And at one point, the doctor, my oncologist came in and basically said that if my white or red blood cell count does not come back up for any reason, then they'll just start palliative care, which is basically pre-hospice, right? So I wasn't going to make it. So it was a very serious situation. And after the first treatment of my second, part 2 of my cancer treatment, I told my doctor that I wanted to stop the chemo. And what she was hoping I would do is I would go through with the double mastectomy, and then after the double mastectomy, continue on with the chemo. And I just told her, no, I can't do that. And she did tell me that there are many, many patients who do not go through the entire protocol of what they have in mind for you. And so if you ever feel where you get to the point where you know you can't take anymore, listen to your body. That's all I'm going to say about that. Let me take a break here, and then we will start the last section. See you guys in a minute. Hello everybody, this is Irene Tobias, and this will be the last part of our video, what to do when you get diagnosed with cancer. In our last section, we ended with my not doing so great on chemo. Um, the next thing I would like to talk about is not to resist anything. And what I mean by that is um, if you, for example, you're going to be given a lot of different opportunities along your cancer journey to reduce the nausea, to whatever symptoms you have. Fortunately, because my team was so awesome, I never threw up once. When my mom had cancer, she was constantly vomiting through all of her chemo appointments. Um, and so, as I mentioned before, everybody reacts differently. I was really lucky that I never um, threw up. I wasn't nauseous. When I did get nauseous, I just took medicine for it. Um, and so you will, when you go to see your team, the nurses, the doctors, everyone will want to know everything that's going on with you. And just don't resist, don't hold back. If you have a headache and you're thinking, oh, it's not that bad, I don't want to, bother anybody. Don't think like that. They need to know everything that's going on because they're monitoring what's happening as you're reacting to all these different medicines that you're given. Um, Again, trust your team. They know how to take care of you. They know what's best. They know how to get you through this, and just listen to them and take their advice and truly put your life in their hands. The next point I would like to make is that cancer doesn't have to be the worst thing that's ever happened to you. I personally am a multiple trauma, I don't want to say victim, I don't want to say survivor, but I've had a lot of trauma in my life. And quite frankly, even though going through cancer was extremely difficult and excruciatingly challenging, it was not the worst thing that's ever happened to me. And so I ask that you don't let your cancer define who you are. You're still who you are. You're still a mother. You're still a father. You're still a brother, a sister, whatever, everything, niece, nephew, employee, teammate, um, church member, whatever. And that doesn't change when you get diagnosed with cancer. It doesn't. It doesn't define who you are. So don't let cancer win. Don't let it take over your life as much as you possibly can. The next thing I would like to say is, your head is going to be spinning with information, with treatment options, with reactions to medications, with so many different things. And try to keep everything as simple as possible. One of the things that I struggled with was neuropathy. And what that means is they call it cancer brain or chemo brain. That's what it was, chemo brain. And so I had a hard time. I just was just really foggy. I would forget things. I didn't know. Well, I felt kind of like my IQ dropped about 100 points. And it was extremely difficult for me to verbalize, and it was really difficult for me to put thoughts together. And so when I was at my weakest, it didn't even dawn on me. I knew that I had a chemo appointment coming up, but it didn't even dawn on me to call my friend and ask her to take me to my chemo appointments. I was just kind of like in this space where it's like, okay, I know I need to get to a certain place and I know what time I need to be there. But the it was not a good idea that I was driving, and I shouldn't have been driving. So, um, and you don't know whether you're going to have neuropathy or not before you start your treatment. And so, as I mentioned before, get all your ducks in a row before. I want to talk about the American Cancer Society. They are an enormous resource, experts. Any possible question you think you might have, they've seen it, they've heard it, they know what to do. And if they don't know what to do, they'll find out what to do to help you. They were a tremendous resource. And again, once you get the diagnosis, you're going to start getting all kinds of information from the American Cancer Society. They have programs, many, many different programs for cancer patients. One of them is helping you get to your appointments. One of them is talking to a cancer survivor that's already been through this program, and I actually volunteer for that program. I talk to people who just recently got diagnosed to kind of tell them what's going on, and you will be assigned to someone that has had the same kind of cancer and is as similar to you as possible. In other words, if you're a woman, if you're in your 50s, if you have children, if you, whatever, they have all of the different criteria, and they try to match you as close as possible to someone who lives close to you and that is in the same situation you're in. So if you feel that that will help you, then please take advantage of that. Just a wonderful, wonderful organization and just a tremendous resource. It's just really, really invaluable. So as I mentioned before, with your family and friends and coworkers, everybody's going to want to know what's going on. And when I had cancer, they had websites where that are particularly set up to have one person in your family or friend post status updates on your behalf. I don't know if maybe Facebook would be enough, or I think they still have those websites where you can have. I wish I remember the name of it. It's been a few years ago, but anyway, my point is just to assign one person in your group, in your group of friends or family, to be the point person to communicate with everybody, because you're going to get to a point where you're going to be repeating yourself 5 times a day, saying the same things over and over again, and you don't want to use that energy up on that. Everybody loves you, everybody cares about you and is concerned about you, but it's best to have one person in charge of all the communication, and then if you do get as sick as I was with the cancer, you're not going to have the energy to talk to anybody anyway. So just think about that. And I would set that up in the very beginning, because in the very beginning, as I mentioned before, you'd be going through all the testing, all that stuff, and everybody's going to want to know what's going on. What did the tests show? What are we looking at? All these different things. And so if you have that set up from the beginning, then it'll be a perfect, follow through for your entire journey. Another recommendation I have is to journal. This is a good source of comfort for you, and also to help you kind of gauge where you are, what's going on, what your feelings are, and just write everything down. In my situation, because I had so many other things going on, do I have ovarian cancer as well? There was a lot of uncertainty in the very beginning. I wasn't sure I was going to make it. I wasn't sure that I was going to survive cancer. And my daughter, as I mentioned, was only 10 years old. And so I was trying to figure out how I can prepare her and what would happen to her if I did pass away from cancer, if I did die from it. And so when I started the journal, I just wanted to share everything with her that she would want to know about me when she grew up as a woman. Um, if I were to have died when she was 10 years old, by the time she became an adult, she would probably hardly remember me at all. And so um, when my parents passed away, they left with a vast amount of information and history and knowledge, family history, historic, what they went through, all of these things that I wanted to know, I cared about. And, they were always like, oh, it's not important. It doesn't matter. Nobody cares. And so they left, at such young ages. And I had all of these questions. And so when I was going through cancer, I wanted to make sure that my daughter had all the information that she needed, or would want to be interested in knowing. And so the beginning of my journaling was really focused on her. And then when we got the plan in gear and everything was moving along, and I realized that I was not going to die from cancer, I was going to make it through, then the journaling kind of changed. But it's going to be interesting to go back in a few years and read what it was that I had to say. So I encourage journaling if it's something that interests you. Let's see. So some things that I wish I knew in the beginning is I wish I understood that I would have a hard time understanding things. I wish I knew in advance that I was going to have a hard time communicating and understanding. Hindsight being 2020, I don't know how that would have changed anything, except for I probably wouldn't be driving myself to my chemo appointments, and it was only a few miles, so I don't want to, give you guys any thoughts of I was, driving down the highway, blitzed down on chemo. No, unfortunately, my clinic was very, very close to my apartment. Let's see. So your port will be your best friend. The port is the device. I can't remember which side. I think mine was on, on this side. It's the device that they implant under your skin, because you're going to get poked so many times whenever you go through your chemo. They don't want to, poke you every single time. So what they do is they implant this little box, and it goes right under your skin here. And 30 minutes before your chemo appointment, you're going to apply this cream over here to numb the skin. And then you cover it with plastic, like a cellophane wrap, so that it doesn't dry out. And then you drive to your chemo appointment, or you're driven to your chemo appointment. And then when the nurse sticks you with the needle to start the chemo, you're not going to feel anything. And that's wonderful, because by this time you've been poked so many times that you're just sore, and your poor little veins are done with everything. So your port is going to be your best friend. I think that's about it. I hope that I was of some help to you on your journey. If you want to reach out, I'm happy to answer any questions. My email address is Irene, IRENE, Tobias, T-O-B as in boy, I-A-S as in Sam, 066 at gmail.com. I love you. You're going to get through this. You're going to make it. Just take one day at a time, one moment at a time, and when things get really rough, 1 second at a time. Only focus on what is happening today, what you need to do today, and worry about tomorrow. Take care. Bye.